So I am Brenda Terrell. I work with Clark County Parent Coalition and Peace, and I'm excited today to be hosting this training with OSPI. Scott Raub is here to give us a presentation for I don't know, about an hour, I suppose, and then we'll have lots of time for questions. I'm hoping you'll have some specific questions that would be helpful for you. So at this time, I will mute participants and hand the microphone over to Scott, and he will share as whenever you're comfortable. I think you can get started sharing. Thank you, Scott.
Thanks, Brenda. It's good to be kind of back with you and your group here. This has always been a good place for a discussion. And hopefully today this will be a discussion. I did prepare something to present in the sense of, the different topics that you sent to me ahead of time. And then I want to build in as much time as possible for kind of questions and discussion. I will at some point also just put my email address and phone number in the chat now ahead of time in case we don't get to that, so that you can have it. And tell you briefly who I am, like OSPI, what is that? OSPI is the Office of the Superintendent of Public Instruction. So we're based in Olympia. We are charged with administering education in the state, and our special ed office administers special ed for the state, which is implemented by all the districts. So our office is that support for districts as well as for families, and that's my role. My title, if you will, is the Family and Community Liaison for the office. So I'm one of the folks that takes the phone calls from families if that's questions, mainly about how to navigate the system. It's a very confusing, bureaucratic system at times, and where do you go? Who do you turn to? Becomes kind of the question. And if families want to know their rights and their options as they go through the process and how to work with school districts, what to expect, I can be there to kind of be that guide. So I'm not a personal advocate or anything like that. There's only there used to be only one of me. Now there's two, and but I do work at the state office, so we serve all districts all across the state. So we try to provide as much assistance and guidance as we can. And that's what today is hopefully for. It's kind of the discussion to sort of frame, this is what's going out across the state. These are the expectations being set, how they apply to your individual students. That's where the questions come up. And hopefully you can take this information and use that when you're working with your districts and your IEP teams and go forward. So I'm going to press enter here. My email address and my phone number are in the chat. Our main office line, actually, if you can't get a hold of me right away through my remote line, is also in the chat too. So those are the different ways to get a hold of me if you have a question, follow up. It'll be in the presentation as well, and we can kind of share that as we get there. So I'm going to share screen, and I've set it up so that we can stop at some point to answer questions. Pull it up. I think everyone can see my screen, I hope. Brenda, yeah, I'm getting there. Affirmative there. Turn off that. So the topic I was going to talk about was asked to kind of lead into the discussion, has to do with recovery services and the kind of roadmap or what's going to happen for the next school year. And I'm going to spend most of the time talking about recovery services, because a lot of confusion potentially out there as to what is that, and how do we get access to it, and what does it mean? And I'm going to break it more into two parts. More generally, first about recovery services broadly, and then secondly, kind of drill down to a subsection of that, which is the recovery services in a transition setting or post-secondary transition. So students ages 16 to 21, because there's a unique factor there with students who have lost time from what we've experienced and continue to experience going through the pandemic. So that's our roadmap. It's going to start with the recovery services. What should I expect? What are they? The post-secondary transition part of it, that burning question of how do you make up for a lost year, even though that's certainly impossible. We're going to talk about what we can do, if anything, to help mitigate or address some of what's occurred. And the questions that I've been getting recently as we try to return back to the buildings is what is it going to look like? So questions about remote learning, what does it look like if your district does or does not offer that? And then a lot of questions around mask wearing in particular, as it pertains to students who may be eligible for special ed services and students who may or may not have different health or medical needs or kind of emotional needs, and as it relates to mask wearing and social distancing. So I'll address that briefly. And a lot of those cases, though, are very student specific. So it's, the questions will hopefully come up there. And yes, a lot of general Q&A, we can wrap up with different things. I won't be speaking the whole time, but certainly we'll make some time for questions, and I'll sort of try to frame or provide at least a starting point for where we can go. So with that, I'm gonna delve in to the recovery services idea. This is kind of a new idea. This is a really COVID generated term. It doesn't really exist in the regulations at all. So what is it? As you see on the screen, there are additional services that address what's happened as a result of the pandemic. It's clear that we were all affected by this, with buildings closing down, IEP service minutes not being provided. There's a limitation on how services are provided. So recovery services, as we try to get back into the buildings, or we have the opportunities to go back into the buildings or have more face-to-face contact, really, you can have recovery services or services that are designed to address, what occurred. And there's some graphics or language I'll get to in a moment that I think kind of help get a picture of what recovery services might look like, as opposed to what you may have already known in special education. Recovery services, as it says there on the second point, the expectation here is it's not a regulation, but the expectation is that districts have to have a discussion about what does recovery mean for each individual student sometime over the course of the next year. So students are supposed to have annual meetings for their IEPs anyway. That's a natural point to raise the question of, at the very least, minimum. Do we need to do anything to help recover from what happened? Are there any recovery services we might want to address? And I'm going to go delve into that more, but that's the idea, that at least one time this year, you're going to have an IEP meeting where the question of recovery services will come up. So recovery services is applicable to all students eligible for special education, ages 3 all the way to 21. And that's why we're going to carve out some time to talk specifically about the students who are older in the transition period of 16 to 21, the post-secondary transition. Because for students who turn 21 during essentially the height or when the pandemic started and have not yet earned a diploma, they still may be able to continue receiving services even if they are older than 21. The link here is in the presentation, which we'll hopefully share with you. And this is the one document I think that has come out from our office that I think that I'm referring to. So all of this information you could find eventually in a more booklet kind of formal sense from that link. And that hopefully we'll share that to go with the presentation you have here. So recovery services, for those of you who've been in special education before, you may have heard the idea of compensatory education. Comp ed, sometimes it's called. Compensatory time or compensatory education is typically what has been used in our field to make up for lost services. It's traditionally been kind of a remedy that's developed by the court system. So if you think of comp ed, you've heard of this word comp ed or compensatory education. It's not a perfect way to think about it, but if you think about it, that's kind of like when a district was at fault for something, or the district admits we didn't do something, this was our fault. They're likely to offer you some sort of way to compensate for that lost time, compensatory education, missed service minutes. Compensatory education, sure, that's how you address lack of progress as well, due to something that typically went wrong in the IEP program being implemented. Recovery services are not meant to replace that idea at all, but recovery services are intended to be something, like it says on the screen, a little more proactive, because the pandemic was really no one's fault here. I mean, this was not something that school districts, developed or closed. They had to close. They didn't develop on their own, all those kinds of things. So recovery services is this acknowledgement that there's a lack of appropriate progress in the students' IEPs, not through any kind of fault of what the districts did, or just something really was out of our control. And so now we're not going to call this compensatory education because that's not exactly accurate. We're going to need to have discussions, like I said, about recovery services. How do we recover, as a whole, society and group, but also this individual student? What do we need to do for this individual student to recover from the lost programmatic time related to the IEP? And when we do these discussions, this last point is we still want to keep in mind, the importance of making sure students are connected to their least restrictive environment, their peers, or connected to what is their most appropriate setting for them to do what they need to do to learn and make progress. So this is a graphic that's in the guidance that we put out from our office. And I think there's just a couple things to pull from it that help with this idea of wrapping your head around what is a recovery service, and so what are recovery services and why do we have them? So recovery services, districts have been told this information. So this is where, when they approach it and in conversations with you, this is maybe where they're coming from. That first box there talks about equity and opportunity. So when buildings were closed, it was very clear that some families had an easier time, or some communities had easier time or access to resources than others, and were able to make progress, and others were not, to continue their education. So one approach to recovery services is to address the inequities that were created by what happened in the pandemic. And if there's additional services that need to be brought to your student as a result of the things that they were unable to do or unable to access with respect to the opportunities to learn over the past year, or since the spring of 2020, when the building shut down and then we had extended closures. That middle box is, I think, another idea that really helps to figure out how are districts approaching it, with this idea of, we're going to triage the situation and we're going to address the most urgent needs that we can. It's kind of like, recovery, you put it in a medical sense. Someone comes into an emergency room, you're going to triage the situation and determine, who's at most need for attention right away. So that's why some students may get recovery services, or their IEP teams may decide, there's an urgent need that we need to address right away with some kind of service. Other students, there may be some time to wait and see how they return to the buildings or catch up, or what was you not see the impact right away. So one of the priorities for a district, when in conversations with you, is to have this sort of triage type of conversation. Let's assess what happened. And that's what that last box is about. It's about transparency and engagement with families. Families need to be a part of the discussion, because families had the front row seat to students being in their homes and not being in the buildings. And as I said at the outset, recovery is supposed to be something that's more proactive and intended to be a collaborative approach to addressing the needs that got created through the pandemic. So that's why it's separate from something a little more kind of fault-based, like compensatory education. Recovery services are really going to address, what did the parents see? What works for you as a family to get the student back to where we know that we potentially think they should have been had the pandemic not occurred. So with that is if you're thinking about recovery services, you hear me talk about what would it look like for my student? Should I ask for these? Or when we have these conversations, what are these conversations going to look like? First and foremost, we're saying that recovery services need to happen and be discussed by each IEP team. So they're individualized conversations. This doesn't mean it's sort of an hour for hour, minute for minute, you are owed whatever was written in the IEP kind of discussion. It also doesn't mean that the district should have this formula that they're using, that you plug in the numbers and outcomes, one base number for to address everything. This is really a nuanced type of discussion to look at what was the amount of progress made pre-COVID and during COVID, and then what do we need to address in terms of the urgent needs or the impact. So that's where you're going to say, you're going to use your pre-COVID IEP as sort of a starting point, or the transition plan that you may have had if you have an older student. And then you look at what did we do during the pandemic and what happened? Was there progress made? Can we point to anything that did work? And then can we point to anything where there was a greater impact that is now having an effect? And so that's why when we talk about priorities, families are a big part of that, as it says on the screen, and key partners in determining how much recovery services, what is it going to look like, do we even need it at all? And I know this is an important thing that Peace, as this organization, has really done in terms of reaching out to the Spanish-speaking community in your area. But as you're interacting with your school districts, ensuring that there is also language access and interpretation and translation of materials so that parents can participate and families can participate fully in this process. If there is a need for any additional language, information in additional languages, OSPI has this information on our website, and you can certainly reach out to me. We have, I think, the 10 different languages of this information on our website. So what should you expect as a family going into a discussion about recovery services? I already said before that you should expect that every student has at least a discussion. The requirement is to discuss. Not that every student's going to get it, but the requirement is for every IEP team to at least have asked the question, does the student need recovery services? Why or why not? And the kind of guiding question is on the screen. A good one to start with is always, what was the expected level of progress on the pre-COVID IEP if the pandemic hadn't occurred? So where would we have expected our student to get in a make-believe world where the pandemic didn't happen? That might be our goal, or that would have been a starting point. And then the IEP team can discuss, are we far off from that or not? From your school districts, the expectation should be that you don't have to make a request as a family to talk about recovery services. School districts, like I said, have been informed of this information. They should know to come to IEP meetings with recovery services as like an agenda item, because you're going to need it to have discussed it or mentioned it somehow. So it's part of the process. But if you haven't heard anything, there's nothing wrong with, as a family, you making the request. And the district has to be responsive to that and answer it, just like any other request you might make as a part of the special ed process. So you don't have to feel like you're out of line at all to ask for a discussion about how are we going to make up for what happened or recover from what happened. So the districts are still need to be open for that. And this last point is that kind of goes back to what I mentioned about the triage is the timing of when all this happens. You know, we've expanded it, and we've said to districts, you know, you've got at least a year of IEP meetings coming up where you can have these conversations. The timing needs to be, like it says on the screen, prioritized based on individual needs of a student. So it doesn't have to happen immediately. And this goes back to the idea of assessment or triage. You know, look at the situation and say, you know, how impacted was the student and how much are they still feeling that impact? Do we really need to do something to stop the bleeding, if you will, to really jump in and address kind of where the student's at to get them back on track so that learning and progress towards goals can happen at the rate that we want to see it happening. So this on your screen is a chart that is in the guidance from OSPI. You know, this is the big chart, so I'm going to break it down into pieces. And the reason I do this is, you know, it's not necessarily to overwhelm, hopefully, but I do think there's some very useful ways to thinking about, there's a step-by-step almost logic or thought process to when you talk about recovery services. And that's what the way this is sort of flowchart is intended to do. And on this flowchart, there are questions. They're basically open-ended questions that you can think about when you are heading into the meetings with your IEP teams. So I'll break it down piece by piece. First band, first foremost is, like I said before, you go back to the pre-COVID IEP. And if you don't have a copy of it, your school district should have it. And you start to ask yourself, what were the students' present levels? Where were they at before COVID? You know, what was the level of progress they were making? What was the services they were getting? So it's kind of like you need a baseline. And those are the kind of questions that you can start to think about as to how do you establish a baseline with your IEP team. And then we look at, when did the buildings close? They closed in spring 2020, and now we're all the way up to the present time. We talk about what are the kind of concerns that you have raised along the way, last school year and up until now. And then how is that different from the baseline that you just talked about? What was the level of progress that we've expected or we haven't seen? And then what were the kind of services that we were able to provide during the closures during last year? And to what degree were we able to make progress with that or implement them? And then that's what leads to kind of this last band of, like, now we have a discussion about recovery. We've established what the baseline is. We established what we were able to do during the height or the closures or during the main part of the pandemic. And now that we're trying to return to the building, you know, what can we do to address any urgent needs once we've assessed or triaged the situation? And if we do need recovery services, you've got sort of this step-by-step sort of boxes to ask the questions of how and when will the recovery services be offered? What options do we have for that? What progress do we expect to see, and how will we track it or keep family informed? And then lastly, you know, based on what we're doing, are the services what we need to be providing? And what should they be? So that's, I think, hopefully setting the table, laying a groundwork for what recovery services are, what they might be. I do want to do a little bit of a deeper dive on the questions around post-secondary transition. So that's the 16 to 21 age group and potentially beyond, because there's a little bit of a difference there, or questions that have already, I mentioned, about students who may have turned 21 last school year or while we were in a lot of the closures and weren't able to access some services. I do see a hand, so if we can answer, we can go ahead and take a question now if you want, Brenda, and I think that would be okay. And then if you have questions about older students, we'll save those for a moment and we'll get right to those in a minute.
All right, thank you. This is Darcy Ladwig, and I feel like I should know the answer to this question, but are recovery services only available to our special ed students? I'm just wondering if we're going to have a big influx of people wanting an IEP for recovery services that maybe didn't qualify before. And I don't know if there's an answer to that, or if.
There is. Recovery services is an idea that's unique to special education. That being said, there is also recovery plans that each school district has been asked to make. And that's related to some of the federal funding that has come into our state to address how does school districts as a whole address learning loss. And so there's a general ed component to recovery, yes. And that's called recovery plans. When we're talking about students who have an IEP and receiving services, recovery services is a kind of like how we've embedded some of this specifically to address the lost special education service time. So that's a good question, because there are services and there are resources that may be made available within your districts to all students. And students with an IEP, they have access to all of that as well. So just because you have an IEP, you're not limited to only services that your IEP team develops. If the whole district as a whole, as a part of its recovery plan, is going to start doing a whole lot other things to address the needs of the general student population, students who have IEPs are still general ed students in the first instance. And so, yes, look out for that in the sense of they're going to be called, I think, recovery plans and some other kind of recovery learning type of services that may be out there. And, when we're offline, I could potentially find or track down some more of that information. But for special ed purposes, recovery services, this information is very specific to IEPs. Did we have one other question, or?
Yes, there's one question I'll read for you. It's in the chat.
Okay.
So the parent says, my son is 10 and was eligible for the 3-year re-evaluation for services last year during distance learning. The school had me sign a waiver saying he didn't need to be reevaluated, but he could still receive his services. Now, when I asked, they said I waived his right to a reeval and he won't be eligible again until 2023.
This is a good question, because I think that there's I appreciate you asking that, because it kind of mixes up. There's some things that could be really clarified here. As a general rule for school districts to follow is that, yes, a student has to be reevaluated every 3 years. So the 3-year reevaluation, triennial reevaluation, is to really update the evaluation on file. It isn't necessarily a waiver that if they called it a waiver, that's a really easy way to understand it, but it's not really a waiver. School districts, if they got you to sign anything, it was an agreement that a reevaluation is not necessary. So you're not waiving a right or anything. It's agreeing at that time that the triennial reevaluation was not necessary, because essentially we all know that it's like basically an agreement that says, we all know the student is still eligible. We're going to continue services. We just don't need to take the time to do a reeval, even though as a school district, we're required to do this every 3 years. So by signing that, you didn't waive a right away. You didn't do anything like that. Essentially, you just agreed with the school district that we don't need to do a reevaluation right now. And I think that's the critical point. You can always request a reevaluation at any time, even though you've signed this waiver or whatever they want to call it. What it really was an agreement not to do that a triennial or 3-year is not necessary. That was the agreement. So if now, months later, or you ask for it, they should still consider the request for a reevaluation and still consider your reasons why. And if you want a reevaluation, they need to give you an answer as to why it will or will not why they think it will or will not happen right now. So I think it's a good question. There's this idea that your student may not be eligible again because you've signed that is not true. You can do a reevaluation anytime there's essentially a need to reassess or get more information about what student needs are. And following a pandemic is as good a time or as good a reason as any to do that. And this is a good question because this happened a lot during the pandemic because face-to-face contact with evaluators was really hard to do. And school districts, they had a compliance concern or interest in making sure that they got their, they stayed on their schedules for reevaluations. And so they may have called it a waiver, but it really was just an agreement not to do it right now. And so I would encourage you to go back to your district and explain, these are the reasons why I want to reeval right now. And as a family, as a parent, you can request a reevaluation essentially at any time, and the school district has to at least entertain that request and give an answer as to what it will do. And if you're having problems with that, I can certainly support you. And I know that Peace and a lot of the advocates who are with us today can help with that. So let me jump into the transition piece. Would that be all right? And then we'll come back to some more questions because questions are good. Okay. The post-secondary transition, some of this is going to be a little repetitive, so I'll go faster. But I do want to hit the point about what is it that students in this sort of age range can really take advantage of. So transition recovery services, what's the big difference? What's the big deal about why are we separating this out? There are additional transition services, post-secondary transition. So the older students with IEPs, these are the transition services to address any sort of similar, same thing, lack of reasonable progress on the IEP goals or the transition plan that those older students are required to have as a part of their IEP due to the pandemic. So we're separating this out because there has been additional funding set aside to address this age group. The second point there is that there's recovery type services. We are using state funds as well as some federal funds to extend transition services for students who were not able to take advantage of them during essentially their age 21 year, or when they go beyond, they're now older than 21. Special education services are supposed to end at age 21. So that's why that became important to address this. Now that we've lost a year and a half of time to provide services, that was critical time for some students to really learn the skills for post-secondary life and transition. And so that's why there's a set aside, and that required some maneuvering with respect to funding because the funding for students is supposed to end at age 21. So that's why there's additional funding that has come across. Is your student going to be eligible for transition recovery services? Generally, same idea applies, is that any student who had an IEP is going to at least have a conversation about this type of services. So if your student is in the transition age of 16 to 21, there's disruption to their kind of learning, kind of a work-based or community learning, they may be eligible at this time. As well as the second point there, if you had a student who was age 21, who turned 21 during the 1920 or 2021 school year, so that means like now they are already 21 prior to starting this year, or now they're 22 or older, and those students have not earned a diploma, those are the ones who may also be eligible for a discussion about transition recovery services. And that's critical because the diploma is really the defining factor. You age out or your eligibility for special education services will end when a student earns a high school diploma. So it can't really get around that piece of it. But if the student, turned 21 or is now 22, sort of aging out of special ed, that did not receive a diploma yet, though, that's where there is still the opportunity to have a discussion about recovery services. What should they sort of be? The last 3 points here at the bottom, very similar to what we already talked about, except here you're going to address the lack of reasonable progress on IEP goals or even the post-secondary goals related to the transition plan. Address any sort of missed services, and then address any sort of lack of progress. Even if it's not just on the transition plan, but also the high school and beyond plan. Students at this age, part of their requirements now, or for graduation, is to have a plan, is to have something connected to their IEP that discusses the high school and beyond plan, which is a general graduation requirement. So if you want to know what we've been talking to school districts about in terms of what they are expected to do, very similar to what we've already talked about. There's the expectation that the recovery services would be considered for every student with an IEP and what progress they did or did not make if the pandemic had not occurred, except now you're putting it in the context of a transition plan. And consideration doesn't mean it's a guarantee. It just means that there at least needs to be kind of a record of a discussion about whether or not this particular student or one particular student needs recovery services. Same thing as we said before, as a family, you're not required to request this or initiate that process. It should already be a part of the IEP process if your student is already there. And IEPs are expected to be reviewed annually anyway. So that's where this process, again, is expected to be collaborative and transparent, where the families are engaged as partners in the process of explaining, this is how the pandemic impacted my student, and this is what we need to recover, triage the situation, and address it urgently. So some examples are listed here. We put these examples out to school districts as well to kind of see these are the different ways that what recovery services might look like. But like we said, this is tailored to the individual student. So if there's something that doesn't fit here, then that's something to discuss with the IEP team. There isn't really a limit on what really you could request or ask for. What it should be grounded back in the pre-COVID IEP. It should be grounded in the lack of progress that you expected to see. And what do we do to address the need?
Let me interrupt just for a second. We have a question in the
Sure.
chat box. Is that okay?
Yeah, why not?
Okay, so it is, the question is there no recourse for a student who graduated, but family now knows that what was lacking before that diploma was awarded?
There is recourse, although it would take more of a formal step, more of a formal dispute to be initiated. Typically in the form of what's called the due process hearing. And so that's a difficult step because that tends to be where lawyers get involved. That's a hearing that goes before an administrative law judge. And you're basically arguing that, yes, this diploma was initiated or issued improperly, and that the student was denied their right to an appropriate education. So that's really the only recourse I think that remains in a direct sense. If the school district is not willing to kind of talk to you about that, or even at least perhaps even use a mediator to go through that, because we have mediation services available in our state. Those are the kind of, if they don't see it that way, the school district is going to kind of potentially be in a place where they could, they're going to say they don't have to have that discussion with you because your student has a diploma. But you still have that right if you wanted to initiate kind of a more formal dispute. And again, that's the kind of question that I could certainly, in our office, can walk you through. What does that mean? What does that look like? How do you do it? You can get the paperwork through our office to initiate that. But that tends to be, a little bit more of the higher stakes when lawyers get involved. And you kind of hear about those those are cases that go before a judge.
Thank you.
Yeah.
And there was one more comment actually in the chat that they were just told by their case manager that the school simply does not do IEPs in the month of September.
They don't do them in the month of September.
Yeah.
Well, that's a new one. I haven't heard that before, actually. If they have a date. Right, then I would schedule the first appointment for October 1st that you can get, that's for sure. And if your concern is about recovery services, well, yeah, there's no regulation that says it has to happen by a particular date. By the annual IEP meeting, each student has the districts are required to review IEPs at least one time a year. So there's an annual meeting for sure. If that gets scheduled in October, then that's the time you would have to have that discussion. The hard, kind of blanket rules like that I think are just asking to be broken because the special education, we really specialize in individual approaches to things. So there's an individual need to have an IEP team meeting. You can request it still, and the district has to give a good reason. And if they're going to hang their hat on a good reason of like, we just don't do meetings in September, that's kind of the district does that at their own risk. But I would still make sure you do it October 1st if you can, and if that's what you want to have, or still also look at the annual IEP sort of date on the IEP. Because there's a date that's listed there. When did you have your last meeting? The next annual meeting has to happen by the next date. If you're not past that date, then you might have to wait. So I talked about examples of recovery services, and this is sort of a good question too. It kind of ties into what we were talking about. How would you expect your school district to document the recovery services? And this applies more generally as well, because some students, they have IEPs, and so you're going to have recovery services either written into the IEP, or the school district may write it into a separate document. School districts are generally documenting things in a letter that's called prior written notice. The top of your screen is that first point. That's very similar to how school districts, kind of give you their formal answers to the different questions and requests that you have. Prior written notice is that it's an awkward phrase, but it's really there so that school districts are always giving you advance notice of what their decisions are. And so if you have recovery services, you have a discussion with an IEP team, after that meeting, you're going to get a notice that says, here's a letter that's giving you sort of advance notice of the services that we're going to implement. So we just had a meeting, we agreed to XYZ. Here's a letter kind of confirming that this is what we talked about, and this is when it's going to happen. Here's the start date. So that's what prior written notice is kind of functioning as here in this, as a way to sort of provide a formal documentation from the district. It's that their formal agreement or recognition of what you've agreed to, really, when it comes to recovery services. The 16 to 21 age group, transition services, it doesn't really fit into a school day very well sometimes. So that's why if you have a student who is older and receiving transition services, it can happen during the school day. For younger students, we don't typically recommend that recovery services replace something in the school day. not unless the IEP team really thinks it needs to. But the older students, the school day idea, a little bit flexible there. Especially if for students who are older, if they're past 21 and they're kind of re-engaging with the district to continue getting services. Because this third point is kind of, I think, where the, might be some more questions to discuss, or it can be a little different, because there are students now who are 21 and older who technically are not eligible anymore, but they have not yet received a diploma. So those are the students who now there's still a possibility that school districts have funding to continue serving. And so that's where an IEP team would need to sit down and determine, at least discuss what are the recovery services and are they still potentially needed? And because those students don't have IEPs anymore because they're 21 or older, that's where you're going to have a different kind of reporting system where you might use a prior written notice letter to document what's going on. So in any case, the takeaway should be that anytime you're having a discussion with the school district, particularly around transition recovery services, the letter they send, the written notice, prior written notice, is where you're going to have, the district will essentially give you that confirmation of what you agreed to and what's it going to look like and when's it going to start, how's it going to work. That's kind of the key document to look for. And then how can transition recovery services be provided? IP teams are going to decide that. I mean, they're the ones in the best position to know the student what needs to be individualized. And that's where we go back to what we already talked about. That chart that kind of gives you those open-ended questions. What was the student's present levels at the pre-COVID IEP? What did we expect to see happen, but the pandemic got in the way of it? What is the student's most appropriate environment? Should we align these services so that the student can still be in the community the way they need to be, or interacting with peers they still need to interact with and learn from, or build skills with? And the same thing with what are the agencies that we need to link up with to help set the student up for post-secondary life, employment or schooling, all those kind of adult services. So those are the kinds of things that, how can it be provided? That IP team has got the freedom to really discuss this. And I would say rely upon what we already talked about, the kind of open-ended questions, but now you're going to put it into this context of how does this relate to, post-secondary life. This was something we shared with school districts, so I wanted to make sure at least families, all of you, and you got to see it. How does the school district staff these kinds of recovery services? This would really also apply somewhat to services generally, but when it comes to transition services, sometimes finding the staff to do it is going to be part of the district's challenge, as well as the transportation. Transportation is becoming a bigger and bigger issue across the state with shortages, but also then just access to transportation. And now using, public transportation is a little bit different because it does require mask wearing in many instances to ride a bus or to be in public spaces. So that may need to be incorporated or considered into the recovery services as to, how is the student able to develop skills to be out in the community and in the workplaces. And I'm going to address that a little bit later too, because I know those questions have come up a little more generally, and there's guidance to that effect that's already out there. I'll wrap up with some of the frequent questions that we got in our office at the end of last school year over the summer. Maybe that's your question, but this is also something that use as a sort of recap. The first question talks about if your student turned 21 earlier in the year but did not receive their transition services yet, can they still go back to school for another school year? The answer is yes, but only if they haven't received their diploma. We already talked about if you receive a diploma, that's a different kind of situation. If you don't have a diploma, yes, they could approach the school district about having recovery services during this school year now. So essentially another year. And how could it be another year? Could it be longer? I mean, that's really up to the discussion. As it says in the answer, that the IEP team would work collaboratively to determine what transition recovery services, if any, are going to be needed, the amount and type of those services for a student. Again, it goes back to the individualized decisions based on the pre-COVID IEP, and then what were the gap or what was the learning loss. So the answer to that first question is yes, but only if you don't have a diploma. And that's kind of what the second question answers. If the student did get a diploma, they graduated in June of 2020, will you still be able to access recovery services? And the answer is no. And that's where there's a link in the presentation to our website, that the dispute options we all talked about, because diploma is a recognition that the student has met graduation requirements. And IEP teams are supposed to determine when a student meets graduation requirements. So that's why, to kind of put 2 and 2 together there. If the student's got a diploma, then it means the IEP team has already determined the student has completed their program. So that's why the only recourse at this point might be a more formal dispute option, because then you're essentially arguing that the district did not provide an appropriate education, or didn't. It made the wrong decision with respect to the IEP team, and whether or not the student still needed to had met all their requirements. Last 2 questions, and we'll take a pause. What happens if your student was able to access the services during the pandemic and there was regression? All of that information is what really needs to be considered when it comes to recovery services. That's exactly what the chart that I talked about in the beginning was kind of pointing to. Was open-ended questions to discuss for the team. Because, the recovery services, you want to fill that gap. You want to triage the situation, or the damage, if you will, from the pandemic, and how do we recover it from it? What is the urgent need that we need to address with this student? And then I already talked a little bit about this last question, but to kind of rehash it quickly. If you're 21 or older and you're accessing recovery services, do you get an IEP? Will the recovery services be documented, and how? And the short answer of it is no, you don't get an IEP because you're 21 and over, but you could still have the documentation from the district and that letter by a written notice that acknowledges what you just talked about and what you agreed to, and how services will be implemented.
There's a question in the chat.
Yeah.
For clarification, it says, so are recovery services delivered in a different setting outside of the student's schedule, or are they they aren't incorporated into their IEP?
Most of the answer to that is it depends, because the IEP team is going to decide what makes the most sense for that student. Our guidance has been, you don't really want to replace the regular school day with recovery services for most students, because you still need to go through your regular school. There's still a benefit to the regular school day. Now, of course, there may be situations where the student has been impacted, or the gap is so far behind that maybe this IEP team has come together and said, look, we need to do like an intensive bit of recovery services now to catch the student up. And we need to do it in the part of the school day. Like you can make that decision. There's nothing preventing an IEP team from coming to that conclusion. So, but the message, to families that I'm giving you and to school districts has been that, replacing the school day should not be the first option, really, when it comes to doing recovery services. You talk about how is that going to, if you're going to do some recovery, something additional, you need to talk about when does it make sense and how to do those things. They aren't incorporated in the IEP. If you're in a transition age student, and if you're 21 and over and you don't have an IEP anymore, then they wouldn't be, transition services wouldn't be discussed there. If you have an IEP, a student is young, still within the age of 3 to 21, and you have an IEP, yes, there's an option to put it in the IEP. There's no requirement that it has to go written into the IEP. The requirement is simply that you have to discuss it with your IEP team, and then you got to document it somehow. So you either document it in the IEP or you document it in the letter they give you, the prior written notice. Right, and I just saw the chat that the follow-up is it's an opportunity to beef up IEP goals. Potentially, yes. That's, if you're going to beef up IEP goals, though, just know that you're beefing up the IEP. I mean, recovery services are not taking the place of what you would do to address student needs, on a regular basis or regularly. So, right, you do in some cases, the district might say, look, we're not going to do recovery services. What we're going to do is we're going to reevaluate, and we're going to add more service minutes overall to the student's, IEP, because the student was impacted to the point where it's going to be longer lasting or something to that effect. So we're not going to do recovery services because that's more of a triage. That's more of a address the urgent need kind of approach. What we want to do is address a lasting impact. So let's add another goal, add another year's worth of, type of services or minutes. So in that sense, that recovery, there's an idea there that maybe recovery services are not the best way to address what the student's needs are at that moment. You're still going to have an annual IEP meeting. You're still going to have the regular process that to go through. And right, maybe that's adjusting the service minutes overall. So opportunities exist, yes, to beef up IEP goals or to sort of support progress really towards IEP goals, either with this idea of recovery services or with this idea of let's revise the IEP and amend it so that students can have more services. You can do one or both of those kinds of things. So yeah, I was just looking at the chat, so that was my pause there and seeing if there's any other kind of question. Because the last thing I was going to bring up was a lot of questions that have been about getting back into the school buildings. And so, leave the recovery services kind of the idea behind a little bit. And recovery services, as I mentioned, is I think for me, it's been most helpful when I talk to families who call me. It is really almost like, I go back to the idea of like, you're in a medical situation or emergency room, and you've got multiple things going on around you. You've got to triage and assess what's the most urgent need right now. Who needs the help the most to get back to the place where progress can be made again, to get things back on track towards being healthy, if you will, if you take the medical idea. So it's that kind of idea that, recovery services, there's not going to be a rule or a regulation that's written somewhere in the law that explains what recovery services are. What they are is this idea that we all got to try to get back what we lost from the pandemic. And it's going to be hard because it had an emotional toll. It had a social effect on a lot of students. So some of the recovery services might look like something like that. A student who has an IEP, there's a unique opportunity for the IEP team to really look at that and have that conversation. And if there's one requirement to remember, it's that OSPI is going to expect every IEP team to at least have had the discussion. It should be talked about. That's really what it boils down to. Everyone has an annual IEP meeting, and at the very, very least, at that annual meeting, one agenda topic should be recovery services and does the student need it? And that should be the expectation. And there was a mention in the chat that there should always be documentation of what was the outcome of that discussion. If it's more services, then we document the more services somewhere, IEP or in the prior written notice letter. if the decision was no, we don't need it, then at least let's write down why we don't think we need it. So with that, I mean, I can kind of wrap up. There's only a couple slides here just to really get some ideas out there of getting back into the school buildings for this year. What's it looking like? What are the questions you might have or I've been hearing that may be applicable? First, I wanted to really get some terminology out there because, you know, I'm very guilty of this. I know in the education world, there's like kind of coded language that we only know certain acronyms and we say them all the time really quickly. So I want to be clear about what I'm saying so that if you're talking to others, we can hopefully all get on the same page. Some terminology to know about all what's happening right now, all the moving parts. As we get back into the school buildings, there's different kind of instructional models happening. In-person instruction, that first, when we say in-person instruction, that's kind of what we know. That's the learning that's going to take place back in the school buildings with an instructor, or for students with IEPs, a service provider who's present. So you're kind of in person with somebody. This idea also, the second point is synchronous. There's this been talked about synchronous learning. So that's learning that's going to take place remotely at a distance somehow. But it happens in real time, in live. It's like you're watching live TV. You're watching, like right now, this is synchronous in terms of me being live and you right here present to hear me. So learning with a student, we're making a reference to synchronous learning with an instructor or a service provider. A lot of that happened when the buildings closed, and so you already know that from last year. But the word synchronous may not be familiar, but that's what's being thrown around a lot. Asynchronous is kind of the opposite of that. Learning that takes place remotely, but it's happening by the student kind of on their own or independently, using some kind of material that's pre-prepared from a teacher or a service provider. So, my kids sometimes did this, I know, during the pandemic, where you have an online program or instructional program, there's assignments dropped in there, and then they had to work on them, and the teacher would check back. You submitted it to the teacher after the fact. It could be work packets, it could be pre-recorded videos, it could be any kind of thing that's happening, not at the same time, but it's happening remotely, sort of on your own or independently. And asynchronous learning could be done and then later discussed, synchronously in person. So, there's kind of ways to kind of work together on that. And this last term at the bottom is called ALE. It's being thrown around a lot. Alternative learning experience. It's a very broad term. It's kind of a catch-all term for, in our state, the option that some districts are doing online schooling programs, or even kind of remote learning programs or site-based courses and learning programs. Alternative learning experience. So it's actually a little more of a structured program. That's what ALE, if you've heard that, sort of refers to. I'm going to put this side by side now. Instructional models that a lot of districts are using, or this is what's out there now in terms of your school districts are choosing from going forward into this school year. The first column is about in-person instruction. We know that's where students are going to be in the building, accessing their hours through an in-person experience. And, our office, many in the state agency have been talking about making sure there's contingency plans for when outbreaks occur, because we know we're living in a new reality with the Delta variant, and that there's protocol in place for when a case gets identified in a classroom, in a building, or even in a whole school. So even though many districts are saying we are fully back, we're open, we're in person, the hope is that there's still a contingency plan for some kind of remote access. The next two columns are what remote access might look like if your district is offering something like that. The middle column is called Continuous Learning 2.0. It's a 2.0 because it's a take on of what we did last year. last year we called that really continuous learning, where we tried to muddle through the disruption of the buildings being closed. Now, if we're going to redo something like that for 2.0 this year, that's what gives the districts, the middle column, the flexibility to provide the services for students who are unable to return full time due to some kind of health and safety need. There's an emphasis on the in-person instruction still, though, because this middle column, if a district is using that kind of model or has an option like that, there's going to be a limit on the asynchronous time. As I mentioned before, asynchronous is that kind of that work on your own independent time. So there's still some requirements there as to how much contact a student is supposed to have in person, either in a seat or synchronously remote over, kind of over a computer or some other mechanism. And then that last column is the alternative learning experience. That's kind of the maximum flexibility for how instructional hours are provided, because that's where the online programs or online school kind of falls into that, where it's a whole schooling program, it's a whole system, or some other kind of setup where it's sort of remote learning through a systematic kind of check-in system. But there's no in-person requirement when it comes to using an alternative learning kind of experience. The caveat here, I think it's important for us who have students on IEPs or work with them, is that it's still possible to do some form of in-person, instruction. IEP services still need to be delivered, and IEP teams are going to talk about what's the most important way, or what's the most appropriate, I should say, way to do that for the student to make progress. So even if the student is in a remote sort of learning situation or context most of the time, IEP teams need to talk about what's that going to look like. And that's why that sort of on the far side, it falls outside. It says across all instructional models, the students are still entitled to basic education and all of the services that go with basic education. Special education is a support service that they are entitled to as a part of their general program. So, no matter what model you hear your district kind of using or offering, special ed services have to be delivered. So this question has come up, in terms of what do we do about the special ed services? If your district is offered a remote option, let's say one of those continuous learning, the 2.0 option, or your district has an online school or an ALE as it's called, for you to sign up for, like you've signed up for remote learning. What do we do about the IEP becomes the question. First and foremost, that top box says that the district should honor that choice. I mean, just because you have an IEP or a student has an IEP doesn't mean they're automatically not allowed to choose remote learning. If it's an option that's available to everybody in the district, then a student with an IEP and a family can select that option too. And I think the question though is, how do we make it work? There's a couple different ways to make it work. The first column, you provide instruction and special ed services, using either the synchronous, asynchronous model. You push it in, you make an appropriate public education a part of the remote learning, a part of the, you push it into the remote learning and the virtual services. In some instances, that might work well. There have been, the families that I've talked to where remote learning has been great for them. So go with that. If that's still an option with your district and you choose that, it can happen. The middle column, one of the options might be to talk about with the IEP team, what kind of hybrid or combination of in-person and remote can we do? Maybe some of the related services can be done safely in a building where it's not around a lot of other students, it's in a controlled environment, or it's at another district location, district building where there's a lot of vaccinated staff, because all staff are going to be vaccinated or required to be at some point. So you've done things to mitigate risk. And so the student could have some of their IEP services in person, and then maybe some of the services are brought to the remote setting or the remote sort of model. So you kind of merge the two. There's sort of that middle column is kind of something in the middle where you do a little bit of both. There's a note there on the second box in the middle that talks about this is where, the homebound placement might come into the discussion, because there are students who are medically fragile or have medical needs that don't allow them, or their families have medical situations that don't allow, it's not safe really to be in the classroom on a full-time basis. So that's where an IEP team would have to kind of revisit placement and look at the medical needs as part of the discussion for making a decision around placement. Placement is kind of a word for setting. What's the most appropriate setting for a student to be learning, to receive their services? And homebound might be the most appropriate. And that's where maybe the services have to go to the home, or staff members come there, something to that effect. But that's where those discussions are going to take place. And then the last column is kind of the last catch-all, where the school district is really saying we got to do in person because that's the best way to make progress. The only way to get an appropriate IEP is implemented is to do it in person, or we just can't do, it's not working. Remote learning is not working for the student. But there's some way or reason that families cannot come to the building or will not be able to access appropriate services. The last column says basically you don't give up at this point. You don't give up yet. We don't want you to give up. What we want you to do is to, well, first and foremost, district's going to have to document the discussion. So you're having this discussion, can't figure it out. So the district's going to document, this is the IEP team decided that appropriate services are in person. That's the best way to make progress. That's what's appropriate education is for the student. So we're going to document that. That's our offer of the FAPE, free appropriate public education. But secondly, you don't give up. You find something that you can do. And this is where the engagement with you as a family is important, because maybe we can still do something to keep the student engaged or connected. It may not be the most appropriate way for the student to make progress, but we're going to provide some form of services. And then third, we're going to keep monitoring what's happening and revisiting the discussion, because we've got to keep monitoring, even if it's not FAPE, appropriate services. We're going to stay connected. We know that there's a health situation going on. We can have future discussions about recovery services, perhaps, or a future discussion about a reevaluation. But that last column is basically don't give up. Even if we can't figure it out, school districts are being told, stay engaged and work with the family to see what can work, even if it is not what's an appropriate public education. The harder question becomes this last slide, where it's like, if your school district is not offering a remote option at all, like they basically say you only have in-person instruction. That's what we're doing right now. That's become harder for families to navigate. Recommendation is to request an IEP meeting, discuss the change of placement, and consider the full range of options. So there's no remote learning as an option at the moment. So that's why the IEP team has to consider, well, even though there's no remote learning, student has some needs that don't allow them to come back into the building. And so that's why the third point is to be prepared to discuss what is a physician saying about the student's health and medical needs that does not allow them to be in the building. Essentially, in-person instruction, as you know it, is not appropriate anymore. We need to think about another option, like some kind of homebound placement or some kind of combination of in-person in a very controlled setting. And then lastly, you follow all the appropriate health guidelines to assess the risk of transmission. So that's the contrast. I mean, if you this screen on your screen is like, what do you do if the district doesn't have a remote option? And then the prior one, I'll slide back. These sort of options is how do we implement the IEP if you do have a remote option and you've opted into it. To wrap up, I wanted to make sure I addressed the question about mask wearing. and what's the guidance out there. It's kind of too much to go into each individual situation because students are very unique, and some students have different capabilities than others when it comes to participating in some of the safety guidelines that we are being established by schools. As families, it's helpful, I think, to know what these resources are and where to look for them, because the Department of Health is what's kind of driving the school district's protocol when it comes to mask wearing and how do you mitigate the risk associated with transmitting COVID-19. So the latest guidance is linked there for mask wearing. And then there's a supplemental consideration for what ideas can you get for mitigating transmission. I think that second point, the second bullet point, you look at that one as to almost get a little more ideas, I guess, if you're going to try for in-person instruction and the student struggles with wearing a mask. What are the considerations to find other ways to mitigate the risk of transmission? And that's where you're going to see ideas about taking instruction outside or having more frequent breaks for the student to not wear their mask. Other kind of things that can happen. The third point too is I think a good one, because we talked about transition services already a lot in the community. The Department of Labor and Industries and Department of Health and OSPI put together kind of health and safety requirements for different scenarios. And this is a lot of it's almost like workplace scenarios. So this is almost like workplace guidance because the Department of Labor is involved. I think that's a good resource to know if you're looking for a student who's post-secondary transition age, 16 to 21, what's it going to be like in the community? What can we do to mitigate the risks out in the community and keeps your students safe as they learn sort of job skills and on-the-job training? So that's a good reference point if you're looking for like, hey, what does the Department of Health say about those kind of contexts or those kind of situations? And the last one was something I just recently found out about, was from the Centers of the Disease Control, CDC, at the national level. They put together a website with resources for individuals who have an intellectual or developmental disability. And so I poked around in it, and I think it's worthwhile enough if you're in that situation or you need just some place to look for ideas and information. There's a whole web page that's sort of dedicated to that. So I think my big takeaway, if you're with your IEP team and your student is unable to wear a mask, when I've gotten these questions, I tried to boil it down to these couple points for a family that I'm talking to. First and foremost, you got to have an IEP team discussion to possibly review what are the accommodations or modifications to the student's schedule or the environment that may work to provide mitigation measures, mitigating the transmission. So somehow stopping or lowering the risk. Because if a mask wearing is going to be inconsistent or is not possible in some way, but some other kind of covering or face shield or some other alternative is possible, what does this mean in terms of how do we modify the student's environment or accommodate the student's environment while they're in a building? Or maybe even the student's schedule. Maybe that needs to be looked at to make it so that it's easier to do certain things at certain times where the risk of transmission would be lower. You're talking with the IEP team. Then the second point about mask wearing and social distancing, other kind of safety ideas, sometimes there's a chance to talk about whether that needs to be incorporated into the student's program at all. If students need to learn some kind of life skill, because that's what really like we're talking about now, given the society we live in, there could be a connection. I am saying it's required. I don't want anyone to think that, but I want everyone to know that there's nothing limiting you from talking about this as a potential type of goal or something to build into a goal that already exists around life skills for a student, or even around social skills for a student. because it's going to be difficult now that we have protocol in the school buildings. So that's another option. Ultimately, too, if mask wearing is not being successful or some of these mitigation measures are not working, placement options need to be reviewed. So that's placement, again, is code for setting. You need to balance the need for peer interaction and being inclusive with your peers, as well as access to instruction and mitigation of risk. So there may be some middle ground there to find out where maybe some of the instruction does need to be in a little more controlled or restrictive setting in order to mitigate risk due to the mask wearing, but other situations, that's where it's a lot easier to have the student be included. So that, there's kind of like a workaround with the mask, or while the student is still getting comfortable wearing a mask, you might have to build up to or work into some of those situations. I think lastly, that point about part-time enrollment or remote learning, those might be the situations that, if all else fails, you've still got some other options to really fall back on, because part-time enrollment allows the student to attend on a part-time basis, basically when it's convenient for them, when they can. And remote learning, if the district has that option, then there's some ways to manipulate the schedule. The OSPI website is linked here because this is where we're constantly updating all of our resources and guidance to families around COVID and in particular the instruction that goes with it and how it's impacting how we do instruction. And I put it in a chat to start the conversation, but that's our main office number. That's my cell number. So there's a remote, way to reach me. I'm on the phone a lot, or I'm doing these discussions, so I don't answer immediately sometimes. But you could always leave me messages there, and then you'll know that I'm getting them. And then my email is a good way to reach me too. This time of year is busier than others, but I'm around. So we always try to stay in touch to answer that kind of questions that you might have. So I'm going to stop that. I think the sharing. And hopefully, I haven't, lost too many of you when it comes to answering some of the questions. But I'm glad to stick around and answer more questions, of course, because I think we've still set aside enough time.
Sure, I'm going to pop right in. This is Brenda, and ask a question before we run out of time. I'm sure it's not just my son that is experiencing some resistance, to say the least, in going back out into society and in going back out into schools specifically. So for clarification, when you spoke about the portion of for health reasons, that includes emotional health, yes?
Yeah. I think you should be prepared, though, to have the backing of a professional, like a physician or a mental health professional, to talk about the mental health struggle that the student is having. Because, right, school districts, they might want to hear it from those professionals as well, to kind of help support what you're saying and what the student is experiencing. So yes, there's no reason why mental health should be excluded from that discussion at all. Mental health is obviously very important.
Well, and I think obviously, as a whole society, our mental health has been challenged this year. So of course, it's going to impact our students as well, possibly even more so if they don't have the necessary skill sets to even process it or talk about it. So I just wanted to throw that out there for maybe some questions or discussion too, because it's kind of the elephant in the room for some of our kids. So
Right,
Thank
and
you.
that's a great point because maybe I didn't make it clearly enough that, recovery services could even include that. I mean, if the student is struggling with anxiety or some aspect of the emotion of returning to school, and that's what needs to be addressed in the short term, recovery services, there's no one way to do it. IEP teams have to talk about it. If the student has school avoidance, for instance, because of the pandemic, there's absolutely no reason why an IEP team couldn't look at that issue of school avoidance and find a way to support the student and call it recovery, to see what we could do to help re-engage. Because, right, a lot of students are really tuned into what's going on in the world and to what the adults are doing and feeling, and they're going to feel it too, and how to process it, all that information. And returning to school can be difficult. So that's happening. Those are the kinds of plans that are happening both in a general ed context, like outside of special education as well. So school districts may be offering that, additional counselors, additional supports to talk through what's happening, because things look different in the buildings now. But also, is special ed services, if there is a particular student who, because we know that, this is our student that we have an individual program for. If we know that the student is going to have those kind of needs around social emotional health and mental health, then recovery services can include that too. So everything we've talked about could address that.
Oh, good to know. Thank you.
Yeah.
It looks like Jerry might be coming out of hiding.
And there's a question I see in the chat that I think is a good one, but I can read that if you'd like, Jerry, and then we can go over there. The question talks about families with medical fragile students who don't want in-person instruction and are being told they either have to come to school or apply for something that's called home hospital or some type of limited access. What do you tell these families is their rights? I would say to that family, you have a right to have a discussion about placement with your IEP team. You have a right to request an IEP team meeting specifically to review, what's the most appropriate setting for my student. So this is, you get this remote learning thing aside, because even pre-pandemic, we've had outbreaks of infectious diseases that affected students who are medically fragile or immunocompromised. I know in your area right here where Peace is, there was a measles outbreak, right, a few years back. And there were students where, going into the building when there's a measles outbreak would have been risky. I'm not trying to minimize COVID by any means, but I'm trying to make a parallel here in the sense of the IEP process is the same. Families have a right to request an IEP meeting to examine what's the most appropriate placement for my student, given the situation that we're in. And it might be a homebound placement. It might be what we talked about, some other combination of hybrid in-person instruction in a home, in-person instruction in a controlled district building or setting, something like that. But those students still have a right to basic education, to their general education and access to it. Particularly, that's if the placement decision is going to be in the home. So I think that's where with a student with an IEP, medical information is going to be really important for those discussions, so that families have the backing of a professional that can say, look, going into the buildings is too risky for this student. You need to bring education to them in another setting, like the home. And you need to bring it to them either remotely, or you need to bring it to them in person, or whatever, given the student's unique needs. Well, that's what I would say your right is that you have a right to have an IEP meeting to discuss that placement. It needs to be changed.
This is Jerry, and if the parents in the space have questions, I would really defer to you because I want you to use this opportunity to ask Scott questions before I launch him, but I always have questions for Scott. Do any of the parents have a, okay.
And we can pause the recording if necessary, if that makes folks more comfortable to discuss their individual circumstances. So.
Yeah, that might be. So the tension in my work that's not new in light of COVID, but it seems to have gotten more intense as a tension, is trying to help families and schools really be on board for the individual nature of this process, because there's always this sort of elephant in the room that is, what do we have programming and resources to provide? And how do the programming and the resources that we've already allotted work for your student? Instead of, I know this guidance is reminding everyone to start with what's going on with the student, what are the student's needs? And of course, that's what I teach families in one-to-one technical assistance, and the trainings that I do through PAVE and all of that. And yet, there continues to be this tension where the districts are telling families, well, we just don't have resources for that, or we're still figuring out our recovery programming. We're not sure yet what we're going to offer. We're still talking about what kind of recovery programming is going to be available. Stay tuned, we'll see. And so families don't know, unless you and I talk to them, Scott, or somebody from Peace, that they have the right to this individualized process. And I'm not sure how that's ever going to pivot, because it's just the ongoing tension is that the district wants to provide what the district's sorted out and figured out how to provide. And the family thinks that's how it works. And so the family comes to the meeting and says, what can you do for us? Instead of how can we talk about what we need and what our student needs. And I just feel like that's gotten really highlighted by COVID, because the unique needs are so individual and specific right now. So I'm not sure you're going to have an answer. I don't really have an answer for the families, except to keep bringing it back to what does the student need and how are we going to uniquely design it to meet those needs.
Right. You're right. I don't know that there is an answer that's very easily given. I think that couple observations, at least, that I've had that kind of align with what you've mentioned, is that, yeah, I think what's happening right now with COVID caught a lot of folks off guard. So I don't think that's a good reason, but I think it has, and I think that's creating instability and staffing issues on the district side. So there is a lot of administrative concerns that I hear about and I answer from districts as well. There are folks out there who are trying to do right by everybody, and it's really hard because they're struggling too. So I think that's the context that we're in. It's really hard. And I think that we've been through this long enough. That's my second observation, is that we've all been going through this quite a long time. And it's hard to comprehend what this means to our lives, I think. And it's exacerbated a great deal of inequities as well. And I think that it's going to be around a lot longer, though, than we, I think, can really fully understand. And I think when it comes to these discussions about recovery services, I anticipate that we're still having them next year and maybe even the year after that. So I know that there's a sense of urgency, and I empathize with that. I feel it too. And I don't know that there's a way to fix that part of it, because that's why there's no answer. But at the same time, I think trying to prepare for the long haul of all of it is kind of what we're trying to figure out. we as a field or in education or all of us even as a society. So that's my observation. I think it's special education services, like when the building shut down right away, I mean, there was a scramble. And I think right now, the push to get back into the buildings is causing, again, a little bit of a scramble, a little bit of an uphill. And I don't know, maybe a little bit to trivialize it because it's a big deal. But, there's a lot of moving parts and pieces going on right now. And there's a lot of information that's going on too, being thrown around too. So I think that's what's causing it. And yeah, getting lost in all of that is exactly, I think, what you said, Jerry. The individualized nature of what we do. That's what makes special ed so special, is what I say, or whatever people say. So because it's a unique approach to student learning and it's an individualized approach. So my hope, and I remain hopeful, is that we will get back to that. The further we get into this new school year and try to remember how we used to do things in a building with each other, even with all the safety measures that we now have to take. So that's I think I have to hold on to for my own sake, my kids' sake, and for all the families and students that I talk to. So, but I think the long haul is that, we're still going to be having these discussions. So, families, we have front row seats to what our students are experiencing, and we're going to continue to bring that forward, I think. And that's what I think is I hope we get back to remembering the individual nature of what we're doing. So should we pause the recording maybe? I think we're okay doing that. I really appreciate everyone who's listened and asked questions. I really do. But just to kind of wrap up, and I appreciate, Brenda, you inviting me always, because it's a really important discussion, and it's important for me to try to get to as many parts of our state as we can